Many believe that urine is sterile. However, the lower urinary tract possesses its own resident communities of microbes called the urinary microbiota, or urobiome. Research is showing that the urobiome is relevant in patients experiencing recurrent or persistent UTIs. Studies have shown that up to 52% of UTI cases involve polymicrobial infections within the urinary tract. The polymicrobial tendency of urobiomes may be the basis for polymicrobial infections. In polymicrobial infections, organisms can interact and cooperate, dividing up metabolic tasks and sharing products. In polymicrobial infections, unhealthy consortia of microbes may interact to provide community members with growth and survival advantages while driving a pathogenic inflammatory process. Even if not all the organisms are directly pathogenic with the UTI, these interactions can alter the pathogenic bacteria's response to antibiotics in polymicrobial settings. Disruption of a healthy urinary microbiome may lead to dysbiosis, which is an imbalance that may permit pathogenic bacteria, fungi, or viruses to cause a UTI. These interactions are important to account for when managing complicated UTI cases and forming treatment plans for elevated risk patients, such as the elderly or immunocompromised. There is a need for more advanced UTI testing that accounts for bacterial interactions in polymicrobial infections that may alter antibiotic susceptibility. This chance can increase or decrease antibiotic sensitivity depending on organisms present. Knowing what organisms are present in the urobiome can provide information relevant to clinical decisions. Personalized treatment for UTIs that account for bacterial interactions can increase chances of a positive outcome. Knowing which antibiotic resistance genes are present is not adequate in order to formulate an optimal treatment plan, as sometimes these genes are not fully expressed. Guidance UTI is Pooled Antibiotic Susceptibility Testing, or PAST, a unique method that accounts for bacterial interactions that impact antibiotic resistance. The evidence shows that Guidance UTI can reduce hospitalizations and emergency department visits. In another study, Guidance UTI was associated with a 13.7% reduction in hospitalization and emergency department admissions when compared to standard urine culture. Guidance UTI better addresses polymicrobial urinary tract infections, where bacterial interactions can impact antibiotic resistance. At Pathnostics, we move patient care forward.